So what are the most prevalent types of eating disorders right now?
I want you to think of eating disorders, the word eating disorder, as an umbrella term. So we have eating disorders, and then different types of eating disorders are different spigots. So we have anorexia nervosa, bulimia nervosa, binge eating disorder, other specified feeding or eating disorder, which that's a new name for it. It used to be called EDNOS, eating disorder not otherwise specified. And those are, I would say, the top most prevalent eating disorders. You have other disorders like RFID, avoidant restrictive food intake disorder, and rumination disorder, and unspecified feeding or eating disorder, but the four I mentioned earlier are, I would say, are the most common. Prevalence rates for eating, binge eating, bulimia, anorexia, individually, I would say, are between 1% to 3% of the population, which is why when we say eating disorders, it's that umbrella term, and it's about that 9% population. What makes eating disorders so complicated is that the pathology looks so different across different disorders. So we say that person has an eating disorder, but what does that mean? Because binge eating looks very different than anorexia, which looks very different than bulimia. And the catalysts for those behaviors are also going to be different, and how you treat those behaviors are also going to be different. So it's incredibly important that me as like a treatment provider, we're assessing for such a broad range of things, because we know with eating disorders, they evolve over time too. As you've shared with your story, it started off with restrictive type tendencies, and then it turned into binging and purging, and then maybe it turned back into restriction. So knowing how people can also jump from different disorders is really important as well.